But just to start off by saying thank you for taking the time to come and join Activity Alliance and a couple of our partners, which we're going to hear from today, about understanding how inclusive outdoor spaces are for disabled people. Like everything, we will move on to the housekeeping. So as you see when you came in, you're automatically muted and cameras are off. There is live caption been available for anyone that needs that, and we are recording this webinar as it's part of our online series of learning. I know our fantastic speakers, we might have questions, so if we can put them in the chat, and between us as Activity Alliance member staff, we'll look to answer them if we can. If not, we'll look to see if we can answer them in the call, or if not, we'll follow them up away from today. And obviously, please participate if you can in the polls that will run towards the end of the session. So the agenda. So you're going to hear a little bit from us as Activity Alliance and what does our annual disability survey say. And then, as you can see, we've got three great speakers there. We've got Megan, we've got Harry, and we've got Ben, which we'll all hear from a little bit further in the presentation. So that's me. I'm Andrew Whitaker. I work for Activity Alliance as the Strategic Partnership Advisor for the Northwest and Northeast. And ADAS, our Annual Disability Sport and Activity Survey, report 7 key findings this year, and we've done online series events for covering some of the other series. So have a look at our YouTube channel if you want to watch them back. And today we're in theme 7, which is the outdoor space and active travel. Okay, so the survey is online. The findings are online, so obviously you can download the full report if you want to, but I've just picked out a couple of bullet points that I wanted to highlight around the key findings. So as you can see on there, disabled people are less likely to be active in almost all spaces except for the home. So what does the finding say? Our finding says that 43% of disabled people would like to be active or active in outdoor spaces, but 46% would like to be active in outdoor spaces. So obviously there's more people that want to be active in and around them open spaces. And then similarly into leisure centres, that currently 22% of disabled people are active in leisure centres. So you can see the highlight there that disabled people do want to make sure that that opportunity into outdoor places is there. And then onto bullet point number 2. It's quite a bit here, so just bear with us as I get that out. So outdoor spaces were a key area when disabled people want to improve. And we broke this down into a couple of asks. So what it came out with, that it was the second most chosen area of focus for government, and that links to our manifesto at Activity Alliances. And then we had 3 key asks from disabled people to help to make sure that places were more inclusive. So it's not going to be any rocket science to anyone, but we will run through them. So awareness and advertising, and disabled people wanted to make sure that outdoor spaces and places had accessibility built into them. So how can we help to advertise and raise that awareness that places out there do, and does it align to the individual's accessibility requirements? To look at promoting and maybe doing some targeted campaign to let that know that that activity or that place is inclusive for me as a disabled person. The clarity of information. So again, as a wheelchair user, I do want you to tell me if there's a blue badge bay there. Is there somewhere somewhere close where I can park my car and then travel actively to that activity or to that place? And there's quite a lot of time that disabled people take to plan journeys. So just ensuring that is factored in, and the communication is important, so disabled people can plan that into their approaches, and different routes, which kind of links into the active travel side, that I might not want to get there in my car. Might want to use public transport, and make sure that I can go with my family and friends and go out in that space. And how does the grey streets enable me to do that? The next one, or the last bullet point that I've just got on here to run through, is around active travel has an important role to play in reducing inequalities. So again, disabled people, 38% of disabled people took fewer trips in all modes of transport compared to non-disabled people. And obviously linked into Sport England's Active Lives data, that it confirms that disabled people are less likely to walk, wheel or cycle compared to non-disabled people. Again, it's something I've taken up myself with hand cycling and other things, but it allows me to be out there with my family and friends as a mode of transport. So how can we use walking, wheeling and cycling as an attractable way to help with my health benefits, to help with my mental health, link with my family, friends, but also it can be part of an opportunity of just being out and enjoying the natural open space. It can help me with managing my long-term health condition, but also understanding that that's not for everyone, and reasonable breaks need to be factored in along journeys and routes. So in summary, then what we want to ensure is that disabled people's lived experience help to influence design, improve accessibility and create safe and inclusive environments. And I will pop a couple of links in the chat once I've finished and I've this little bit. But obviously there's some fantastic partners out there, such as Sport England, Sustrans and others that are doing some really great stuff, as well as ones that we're going to hear from today. So let's move on. I'm going to introduce Megan, and I'm just going to leave it there so that Megan can introduce herself from Transport for All. Thank you.
Hiya. My name's Meg Barnett. I'm from Transport for All. So I'm just going to run you through a quick little slideshow of our recent Are We There Yet report and run through the highlights and active travel findings. So if we could get the next slide up, please. The next one through. About Transport for All. So we're a disabled-led organisation with a mission to break down barriers and transform the transport system so we can make the journeys we want with freedom, dignity, ease, and confidence. So in our work, we adopt the social model of disability. So it's the view that disabled people, we're disabled by the barriers that exist in the world rather than our individual bodies or minds. So about our report, we published it end of last year in December. So it's a State of the Nation report on accessible transport with over 500 participants, and they completed a survey on their travel experiences. So we covered all major modes and at every stage of the journey, and they're from across England with a pan-impairment approach. So it was individuals with a range of impairments and disabilities. You could go to the next slide, please. Thank you. So these are our headline findings. So 56% of respondents reported being unhappy or extremely unhappy with making journeys. 44% felt the accessibility of transport and streets are going to worsen for disabled people in the next 10 years. Respondents made an average of 5.84 journeys per week, so a third of the national average that non-disabled people make of 17 trips per week. And then if transport were accessible, disabled people would ideally make an average of 10.84 journeys per week, so nearly 50% more than we currently do. And then these are just two quotes from some Are We There Yet respondents. So the first one is, "My world has become very small." And then the second one is, "It absolutely impacts all areas of my life. Journeys take me 2 to 3 times longer than non-disabled people, which eats into my free time. It means I have less time to spend on things I enjoy. And sometimes the journeys to go somewhere is so long and exhausting that I feel like it's not worth doing, as I'll be tired by the time I arrive." So if we could go to the next slide, please. So our findings on walking and wheeling, only 20% said that they could walk and wheel with ease, while 6% said they couldn't do it at all. So we found that a lot of participants said they wanted to make more journeys by walking and wheeling, but the barriers to do so were stopping them from doing this. And then considering that all of these barriers at this stage, because all journeys begin with like some form of walking or wheeling or active travel just to like get to the station. So if you have barriers at this stage, it can render all other modes of transport inaccessible. That we thought, suggesting that at least 80% of disabled people face barriers every single time we leave the house. And that's another quote from a respondent who said the pavements are really hazardous and they've had a number of falls due to the poor services and have scars and broken teeth as a result. Next slide, please. So these are more of a findings. 77% of respondents cited poor pavement services as their barrier, with 32% identifying it as their most significant barrier to walking and wheeling. 57% experienced pavement parking, while 65% experienced street clutter. And 12% said they cannot walk far unaided, but they're unable to access a suitable mobility aid, like through the NHS. So financial barriers is another massive thing that they're experiencing, and the cost of them, especially if it was, if they have like automatic, a battery powered, not a battery powered, a charged one as well, the cost of living, that's going to make it even more extortionate. And then 37% reported barriers of a lack of public facilities, such as accessible toilets, water fountains, and seating. And then as a result of these barriers, the most common impact was journeys being made more difficult and stressful by 66% of respondents. And then for cycling, we found the average disabled person makes just 2 journeys per year by cycling, compared with 17 for a non-disabled person. And on average, respondents rated their experience of cycling as 0.62 out of 3. So it's the most poorly rated mode of transport in the survey by a large margin across impairment groups and at every stage of life. So only 4% said that they could cycle with ease, while 40% said we couldn't cycle at all. And then another quote from a respondent is, all the times I could have used this especially adapted hand cycle if such things were readily available and affordable. I feel sad, discriminated against, forgotten, and unimportant in society. And then for the barriers for these, 35% reported dangerous roads and risk of collision as their most significant barrier to cycling. 26% reported wanting to use a cycle as a mobility aid, but face barriers to doing so, such as insufficient infrastructure by 19% of participants and having nowhere to store it at home by 14% of participants. And then 18% said that they were impacted by a pervasive belief that disabled people don't or can't cycle. So if held by decision makers, these attitudes can reinforce the physical barriers we face, because if they believe it, then they don't fund it, and then we don't have access to maybe hire or buy adapted cycles. So it's just the cycle continues. And then as a result of the barriers participants experience, the most commonly occurring impact was being stopped from cycling altogether, reported by 72% of respondents. Thank you. So just going back onto like the financial barriers a bit, as well as I've slightly touched on it earlier about the cost of a wheelchair. So that's a massive thing for pedestrian journeys. But 44% of our respondents reported their total income is below £20,000, which is well below what Joseph Rowntree Foundation says would be the minimum income standard. And then financial barriers prevented 13% of respondents from accessing a suitable cycle or storage space. So adapted cycles can be prohibitively expensive, with the cost of even the most basic cycle being several £100s, with most e-assisted cycles sitting at the 3,500 mark and beyond. And then of the 26% of respondents who stated that they would like to use a cycle as mobility aid but face barriers to doing so, cost was the most cited barrier, with 25% reporting the cycle that they would need is too expensive. And next slide, please. So for our recommendations, I've only just included a couple of the core ones that are related to this, but if you wanted to have a look, I can link the report later on in the chat. But we want to work constructively with those responsible for policy and practice in the transport sector to ensure disabled people's experiences are influencing decisions from the boardroom to the front line. So we want national government, local government, regional transport authorities and industry to meaningfully engage in co-design with disabled people organisation and the disabled community when designing, delivering and evaluating vehicle schemes and infrastructure. And we want them to implement a single regulator with a remit for accessibility encompassing all transport modes and street space to fully enforce existing regulations. Then we want them to collaborate with each other and with disabled people's organisations to develop and implement transparent prioritisation methods that reflect the reality of the current inaccessible transport infrastructure, coupled with funding and proactive audit programmes. And then finally, we want them to take action on the extra costs of travel faced by disabled people. So this can include expanding concessions and expanding the eligibility of concessions, and also addressing the additional costs that it costs to be disabled, such as like the high cost of adapted cycles and also mobility aid costs that are currently inaccessible on the NHS. Thank you. So yeah, if you've got any questions, if you could just leave them in the chat, and I think maybe we might have time to come to them at the end. But yeah, that's it. Thank you so much.
Perfect. Thank you very much, Megan. Yeah, there has been some questions in the chat. So if you do have time to have a look at them, that'd be perfect. If not, we will obviously be picking up post today's session. And then I'm just going to hand over to Dr. Harriet Larrington Spencer, who's going to take us through the next bit. Thank you.
Thank you so much. So if we go on to the next slide, I am a research fellow in the Active Travel Academy at the University of Westminster, and I'm also a disabled person. So I'll reflect a bit on my research into active travel and also my experiences traveling actively. So this is a piece of work that I am desperately trying to submit today, so it should be published very soon. And it's about what is active travel. So the kind of most popular definition of active travel at the moment that we're working with is travel in which the sustained physical exertion of the traveller contributes to their motion. So this is walking, e-cycling where you're using the pedals, manual wheelchair, skateboarding, these kinds of things. But what this is a really normative understanding of what counts as physical activity, because for disabled people, if you're using a powered wheelchair, an e-scooter, a mobility scooter as your mobility aid, there is physical activity incorporated into this in terms of how you're sitting, how you're moving. And it's a very, very limited understanding of what physical activity can be. And then there's also this problem of we're separating modes of travel, so fully electric mobility aids from you know, walking and cycling, that actually there's no point in this because we use the same infrastructure. And I really like the definition of from Wheels for Wellbeing of walking, wheeling and cycling, where wheeling incorporates fully powered mobility aids and e-scooters that disabled people use. So the next slide, please. So I have an upper limb impairment since 2017 when I was hit by a car or a driver, and I became chronically ill because of this shortly after. So because I couldn't cycle a two-wheeler, I got an adapted electric trike. I got a cargo one because I wanted to be able to transport my dog. And it works incredibly well for me, particularly because I was very scared of being in a motor vehicle after this. And it allows minimal pain, it's hugely enabling, and I can carry shopping independently. To pick up on what on the Transport for All kind of stats, this cargo trike you see here was £5,000. The storage for it was another £1,000, and it costs £50 a month to insure. And it's only suitable for kind of inner city urban journeys. So that's kind of the barriers that we're seeing in terms of the finances. But actually, if we go on to the next slide, there's other barriers that I experience when I'm trying to cycle around. So this is a community sourced map of Greater Manchester, and these are all the barriers that are on traffic-free routes. So the photo is me on a cargo bike next to an A-frame barrier that I can't get through. And these traffic-free routes are really important in active travel networks for connecting spaces where the pavements and roads aren't great for walking, wheeling and cycling. But there are also just really nice places away from cars where we can be physically active. So this is Greater Manchester, this map where there's so many, I mean, there's hundreds of barriers, but across the UK, these are barriers stopping disabled people accessing spaces for active travel. So very, very significant. And then in addition to this, if we go on to the next slide, there's kind of, I think, when I think about cycling and what it enables me in terms of being able to move, being able to be independent, walking causes a lot of pain, and I'm still very nervous about public transport and motor vehicles, the possibilities really expanded of where I could get to. But because of the barriers that I face, the actual geographies of my everyday life contracted when I started cycling. And so part of that was these barriers on the traffic-free routes, but also just within active travel infrastructure that we see in urban areas. So to the left is a photograph. This has thankfully been changed now, but it's of a cycle lane on a road that's probably not more than 50 centimeters wide. So it actually meant I can't access it on my trike. And then the middle picture is my trike on a new bit of cycle infrastructure. And the camber on the infrastructure is so steep that my trike is at a tilt, and it is terrifying, and you risk tipping over. And it's the same for other people on using mobility aids as well. And obviously this is for cycling, but kind of the infrastructural challenges that people experience wheeling as well in terms of the pavement are quite similar. And then what I also experience, and I'm sure many disabled people in the room know this all too well, is that when you are disabled and you are visible and you start using a mobility aid that makes you even more visible, you're so vulnerable to abuse. So the amount that I get when I think cyclists already get abuse, but the additional abuse that I get when cycling as a disabled person has really been compounded. And it's often the abuse is when I can't use the infrastructure available. So where I live is a protected cycle lane, and I would like to use it, but it's quite narrow and it doesn't feel safe on a trike, so I use the road. And then I get buses beeping and drivers shouting at me because I can't use the infrastructure. So if we go on to the next slide. And it's really important that disabled people can access active travel. I think Transport for All has gone over some of these facts. So disabled people are less likely to live in households that have access to a vehicle. So active travel becomes more important. And there's health benefits for physical activity, and there's health benefits of getting out and about, and there's a social connection and access to health services and access to employment. And I use these all the time, but actually what I'm increasingly thinking is I use these as a justification of why disabled people should be able to access active travel, should be able to access active travel infrastructure. But like, we shouldn't have to justify it. For basic equality, disabled people should be able to access the transport modes that we need adapted to us, the same as non-disabled people. And I think this is something in my work that I'm going to start being a lot clearer about. If we go on to the next slide. So I'm going to reflect a bit on what's coming up a lot in active travel research when I'm looking at disability, and that's conflicting access needs between disabled people. So these are two examples that you might know. So one is a low traffic neighbourhood, and the picture is of a modal filter where there's the flying motorbike and car sign, meaning that cars can't go through the filter. So for low traffic neighbourhoods, for a lot of disabled people who rely upon cars as mobility aids, the low traffic neighbourhoods can be quite problematic as they increase journey times, that can increase pain. Obviously, it's annoying. We all know how much time it takes to be disabled. So to have more time in the car because of that is really annoying. But on the other side, there's disabled people who can't drive or don't have access to a car, and the conditions for walking, wheeling and cycling have really been improved. So there's quite a conflict there. And another example is bus stop bypasses. So this is a cycle lane that goes behind a bus stop in order to prevent cyclists having to go into the carriageway. But these, so obviously quite beneficial for disabled people cycling because dedicated separated cycle lanes are really important, and also the other mobility users can use these cycle lanes. But for people with visual impairments, these can be very difficult because of this interaction with the cyclists. So again, we have this conflict, and this is something that I don't have any answers to, but I'm thinking about. So if we go to the next slide. I think it's really important to recognise that we've been here before with access conflicts in active travel. So curb drops are a really good example of this, that I don't know if you know about how they came about, but for visually impaired people, the preference wasn't for curb drops. For wheelchair users, the preference was for curb drops. And it was in kind of urban design post World War II, I think, that then the solution came up with curb drops, but with tactiles. So still a bit of a compromise. The tactiles aren't brilliant for wheelchair users because of the bumpiness. The drop is not necessarily preferred by visually impaired and blind people, but they've got the tactiles. So I think what we can do is recognize that accessibility can be a really binary concept. Can we access something? Can't we access? But actually, if we move to this kind of lens of inclusion, it's about recognizing that we're all going to have to negotiate our experiences of access to make sure that no one is excluded. And within this, we have to recognize that active travel interventions are happening within a context where the needs, I've lost what I'm saying. Oh, so that's been messed up, where the needs of car drivers have been prioritized above all other forms of travel. And I think kind of a bit of a word of warning perhaps as well is that quite recently we've seen the current government stoking debates on active travel infrastructure like bus stop bypasses. And I think it's really important to be so clear that this is not about supporting disabled people. We know that the current government isn't supporting disabled people. We only have to look at kind of their behaviour over the recent kind of few weeks in terms of welfare, that their actions are about creating culture wars and social division. But what we need to do is come together as disabled people to work out these access conflicts ourselves. So yeah, that's it for me. I think I went a bit over time, so sorry.
No, don't be sorry there. Thank you very much for sharing that. And again, same as Megan, there was lots of great interaction in the chat. So if you've got a little bit of time, Harry, to have a look, see if there's anything you can answer, that'd be wonderful. But just to say to people, because it has come up in the chat a few times about sharing the slides and the insight and the data, we will obviously be doing that after the session. Thank you, Alex, seamlessly there that you put. So we'll move on to Ben Andrews. Ben, I'll let you introduce yourself. Over to you.
Cheers, Andrew. Hi, everyone. My name is Ben Andrews, and I'm Managing Director of Beyond Empower. It might be useful at this point just to flip to the next slide, Alex. So Beyond Empower is an organisation to help make places more accessible for disabled people, specifically to improve health and well-being. And Beyond Empower was born out of my own experience. So similar to Harry sharing hers, I'm a disabled person too. I'm registered blind. And growing up with the condition, you become aware of how outdoor spaces often aren't built with you in mind, thinking back to being a child when the street lighting wasn't necessarily adequate and there was lots of street clutter, so it meant that I couldn't be outside with my friends because part of my condition is night blindness. Going on to the football pitches, which had indefinite repairs on the floodlights, so that meant that I could only play football for about 60% of the year before the dark night started coming in. And then as an adult, jogging, running around different places and always being conscious of uneven paving, curbs, overhanging branches, that sort of thing. So Beyond Empower was born out of trying to make that type of stuff work better for disabled people, and also an acknowledgement that for a lot of disabled people, it feels like there's an expectation sometimes that you are to access specialist stuff for disabled people. Now, I went to a mainstream school. I always access mainstream opportunities to be active and access outdoor spaces. So I wanted to access things alongside friends and family. So trying to make the mainstream more accessible was something that I wanted to do. So that led me to set up Beyond Empower, and Beyond Empower has three sort of core offers. So we have our Empower You service, and that's commissioned by NHS Greater Manchester and Trafford Council, and we work with local disabled people, find out what activities they're interested in, accessing locally. We go out and find those activities and work with the providers to make them more accessible. That could be getting in some raised beds to make gardening provision more accessible for people who have limited mobility. It might be helping walk leaders understand how to guide people who are blind to enable them to get around the walking or wheeling route. So it's whatever people come to us with and wherever the gaps are in provision. And then we're then for about 8 to 12 weeks to support that person or group to access that activity, trying to get them to the point where they don't need us anymore. And that works for about 80% of those that we work with. After 12 months, they're still accessing the activity, the changes have been made, and they don't need that specialist service that they sort of was once reliant on or not aware of. For those that need longer term support, we have a community outreach offer, which is an alternative to social care. And that enables us to work with people as long as they need us, and they access that through their social care budgets. And we also have a consultancy and training offer, working with organisations from infrastructure, design, marketing, parks and green spaces, walking and wheeling organisations. So yeah, anything to get disabled people moving more. And some of the things that I've picked up learning wise that might be useful to share, which some people might already be aware of. So the first one is that disabled people just tend to want to access things locally. And I think because of the sparsity of local inclusive provision, that can be difficult. So how can we make some of what we've already got going on locally more accessible to disabled people, rather than trying to reinvent the wheel and create things specifically for disabled people? Some of that stuff is needed, but not maybe to the same extent as we may think. And from my learning, a lot of providers of outdoor activity and indoor activity want to work in more accessible ways for disabled people. So how can we help them better understand how to meet the needs of disabled people? And I think there's a lot of training out there, and there's a lot of opportunities to learn how to work with disabled people, but sometimes that's lost by not having the immediate opportunity to practice that with disabled people as a new client base. So how can we sort of meet the two, provide the training, but also generate a demand of disabled people to access that activity at the same time? And a key point for a recent bit of support we provided to a walking and wheeling route walk leader is to try and stay clear of terms like fully inclusive and fully accessible for disabled people. Although it feels like a nice badge to have on your activity, initiative or offer, it doesn't mean much to a lot of disabled people, because as Harry touched on, accessibility is so broad, it's conflicting. So for organisations or spaces to try and absolutely assure access or inclusion is likely impossible. So instead of doing that, it's about speaking about the features of your offer. Is it got good lighting? Has it got level access? Has it got easy read provision? Whatever it might be, talk about those features of your offer, what makes it accessible and what makes it inclusive. And that will allow disabled people to make an informed choice and decision as to whether it's accessible or not, and gets organisations away from trying to assure something that just is impossible to assure, especially in outdoor spaces when we're dealing with nature a lot of the time too. Next slide, please, Alex. Another thing that I'm involved with through Beyond Empower is I chair Greater Manchester Moving's commitment to inclusive design network. And this is something that was set up a couple of years ago. It's a coming together of local disabled people's organisations, architects, planners, people within transport for Greater Manchester, and relevant roles throughout different localities within Greater Manchester. And it's a come together to try and tackle some of what Harry touched on in trying to come to a consensus around what inclusive design looks like in practice. I think there's a lot of will there to implement inclusive design features, but there's conflicting demands between disabled people within the community itself and between professionals with the sort of technical expertise. So that's a coming together to try and thrash out how can we make some inclusive design features more accessible and come to a consensus around that and try and find a happy medium. And then from what we find, that is then fed back to Transport for Greater Manchester to inform their Streets for All technical guidance, which will be given to local authorities about how they can implement inclusive design within their areas. So we meet about once a month to discuss everything from tactile paving. We're on bus stops at the minute, pavements, bollards, any design features that we're experiencing in the physical world, we're there to discuss and trying to come to a consensus around. And the other side of that is we recently provided some training to Transport for Greater Manchester. And this was guided routes with local disabled people with different access needs to just bring to life a bit of the conversations that we was having on the online meetings. So there's people who use wheelchairs, people with visual impairments, older people, And we're trying to involve younger people to try and get as broad a spectrum as possible on what inclusive design means in practice, what are some of the issues and what are some of the solutions. And some of the learning from that, which might be useful for people, is one, if you want to talk about how to sort of facilitate that group and bring it together, happy to do that. I know there's a question from Bryony about how we can better do that, so happy to speak about that separately. But sometimes from locality's perspective, it's as simple as habits and preferences getting in the way of inclusive design. So for example, there's a habit of only placing tactile spinning cones at crossings on the left-hand side of a crossing point. And this creates issues for blind and visually impaired people, because if that crossing is busy and they're on the other side of the crossing, that's really hard work to get across to that other side to understand when it's safe to cross the road. And if that crossing point is pooled, there's a lot of people there, then that becomes inaccessible to them. It can be quite an awkward and potentially confrontational interacting with the general public. So we could have tactile cones on the left side, but there's just a bit of a habit that they're only placed on the right, and there's no standards or anything suggesting that. It's just the way it is at the minute. And I don't think it's done intentionally, because once you raise awareness of it and it's pointed out, people are willing enough to change. But sometimes it is habits and preferences stopping us from implementing inclusive stuff. People generally want to be more inclusive, is my finding. I've not met anyone yet who purposely wants to exclude disabled people, but it's how do we create that consensus and provide assurance that this inclusive design works. We're working on a lot of guidance at the minute. There's some things that are sort of mandatory, but they're from they sort of try and stay clear. They try and be quite vague. So some stuff does need updating, and I think some guidance needs mandating so that people, it's made sure that people are implementing the most up-to-date inclusive design practices. And finally, the other side of what localities have found hard is engaging with local disabled people and other groups who might experience barriers in the public realm. How do they engage with these groups to understand what inclusive design looks like? And even though some standards could be set to advise around this, it's always useful to have that local insight in place, because some design standards just won't work in practice in the real world, and that's why you need input from disabled people or other groups experiencing that specific place. So some of our learning has been that some areas, the sector around disabled people, young people's organisations, older people, just don't have the capacity to provide that advice. So how can we strengthen those organisations to enable them to work closer with localities to advise on specific design features and plans? And all of my work up until about a year ago has been with adults. If you just want to go on to the next slide, Alex. And as much as I enjoy working with adults, it's what's become apparent is that people don't, as I've said, don't necessarily put these things in place purposely. It comes from a lack of awareness and understanding, which is nice in some ways, because we know that there's no malice towards disabled people. Nobody's purposely excluding disabled people. But at the same time, that cycle's got to stop somewhere. We've got to try and break the cycle of that lack of awareness and understanding of access and inclusion. So that led me to write a series of children's picture books, which Andrew has asked me just to share a bit about today, because it might be access and inclusion in a bit of a different way. And Better Places is the name of the series of children's picture books, and it's to help children think about how places can be made better for disabled people. It was something I wrote and got published last year. The first book in the series is Nikki and Candy's Street, and that follows a young girl who's blind and her white cane Candy, and Candy's sick of being swung into post science trees, all the good stuff that we get on streets at the minute, and ask the reader to help make the street a better place by flicking objects out the way and stuff like that. And the coming books will look at people with other access needs. And the books have taken me to schools across the UK to help open up the conversation about access and inclusion with children and young people. And I suppose children and young people aren't always people that we think about when we're having these conversations around access and inclusion. But for me, it's vital to have this conversation, because they are the next generation. They're the planners of tomorrow. They're the people tomorrow who might be leaving the bins out or not, creating barriers for blind and visually impaired people. They're the people who will be representing their local authorities. And I think sometimes we forget about children and young people in these conversations, and there's a lot of disabled young people who need the changes by you know, the classmates and stuff too. So the things that I've learned from engaging with children on this topic is kids do know this stuff already. Kids know that it's a silly idea to put trees, post signs in the middle of pavements. They know that some people will be able to see some colours better than others. So they've already got an understanding of access and inclusion. I think somewhere over the years, as life gets more hectic and resource and budget starts coming into play, that's lost. But it just emphasises a need to continually have these conversations at all ages to make sure that as children grow, it's something that's just part of them, who they are. And as they're adults, hopefully they're not creating the same barriers as we see for disabled people today. And I suppose the other side of it is that access and inclusion as a topic can feel quite heavy and daunting for a lot of people, and it can be quite off-putting. You know, it's some of it around disabled people is built on a disabled rights movement, and people just don't want to get involved in that conversation. So how can we have different conversations about access and inclusion, a bit more of a fun and light-hearted way to try and open up the conversation to more people? And that's pretty much me. Alex, if you want to go to the next slide, I think there might be an opportunity for questions after this, but those are my details. If anyone wants to get in touch around how to engage disabled people's organisations around accessible inclusive design, how can you create similar structures to the inclusive design network that we have in Greater Manchester, I'd be more than happy to share.
Perfect. Thank you very much, Ben. Obviously, I've been trying to keep a note of the chat and backwards and forwards, but just a massive thank you to yourself, Harry and Megan, for sharing your insights. Again, really positive feedback from everybody about it, and obviously kind of bringing that to life through using lived experience has also been really, really valuable. Lots of people wanting to know about kind of where the insight came from and other things, so we will try and kind of capture that in the post kind of follow-up. There's obviously been a couple of bits out there, questions around kind of signposts to best practice or signposts to documents that maybe can try and help support. So I don't know if anyone's kind of got any that would that they would advocate for, and obviously either share in the chat or obviously take yourself off from mute to the panelists and obviously share that with the rest of the group. That'd be wonderful. Just there's a lot of information to absorb, and I didn't practice this, so I do apologise for putting panelists on the spot. But I'm just wondering if there was any kind of key takeaways that you want people to leave with today before we kind of wrap today's session up.
I think for me, just on my final point, I suppose, is just reaching out to local disabled people's organisations in your area and understanding how you can work with them. I think we've got the insight, both sides of the technical expertise sitting in localities and sitting in the organisations that you might present or represent. And then we've got the insight from disabled people in localities who are usually more than happy to share. They might, you know, need some level of resource for that, but it's just about connecting the two and facilitating more than that, and not being scared of having a conversation, I suppose.
Yeah, I would follow that up as well, kind of just, yeah, basically saying the same thing as Ben, is having those conversations, and that some of those conversations are going to be really hard around these conflicting access needs, because as disabled people, we spend so long having to make our modes of transport accessible for us and come up with barriers time and time again, that when we find something that works for us, if there is something that potentially impacts on that, we're going to be scared, we're going to be worried. And it's being able to sit with that and spend time on that and not think, oh, that's a conversation we can't have, but recognize it's a conversation we need to have.
Yeah, I'd say the same. Like, our main point would just be co-production and consultation with the pan impairment range of disabled people, so we can collaborate and we're not fixing a barrier but then making another barrier for a different impairment group. So I'd say definitely cross collaboration between government departments, local authorities, but then definitely different communities within the well, within the communities. So taking an intersectional and plan impairment approach for sure.
Yeah, no, that's perfect. And if I could have probably scripted 3 perfect answers, I think you all came out with them. So thank you very much for that. I think, yeah, you're really important. That authentic voice of disabled people helping to influence is absolutely, massively important with it. So I'm not going to put you on the spot and ask you any other questions. It was just for kindly from ourselves at Activity Alliance, just thank you for giving your time, coming and sharing your insights. And obviously you just massive of expertise as well, really valued. The chat says exactly the same. People have found it a really great session. We will try and collate some of these questions up kind of in the post bit. So obviously, if you don't mind, there probably will be further conversations from people on the call today, because hopefully we can share your contact details within that, so people can maybe follow up. But yeah, just a massive thank you from ourselves. We'll finish a couple of minutes early because it's nearly lunchtime. I think people's bellies will be ready. But yeah, thank you to everyone for joining us on today's call, and we look forward to seeing you again soon.